ideal repair scenario for the meniscus repair. Traumatic tear due to acute injury in a vascular or a red zone with a tear length more than 7 mm, and if the knee is stable. So that's an ideal repair scenario. If a repair is indicated, then you have to select the patients, you have to prepare the site of meniscus tear, and eventually you go ahead and do the suturing or the repair of the meniscus tear. The prerequisites of meniscus repair are: it should be unstable tear, meniscus substance should be normal, it should not be a degenerated meniscus, and the knee should be either stable or you should stabilize the knee simultaneously at the time of meniscus repair. However, there are few tears which are unsuitable for repair. Let's say if it is a double or a triple bucket handle tear, if it is more than 6 mm from the periphery in a poor tissue vascular zone, it's a degenerative tear, or the knee is unstable, or patient is having a poor rehabilitation compliance. In these scenarios, it is not desirable to attempt the repair. If you are going ahead and you have decided to repair the tear, then there are various techniques like all inside, inside out, and outside in. Usually for the posterior horn of the meniscus and sometimes for the body, we do the all inside repair, and for the anterior horn, usually it's an outside in technique. However, if you talk about inside out technique, it is usually attempted in the body. So basically in the body, depending upon the surgeon's preference, you can do an all inside, you can do an inside out, or the outside in technique. So if you have decided to repair it, then you should prepare the site of tear. You use a rasp, remove the non-union tissue from both sides of the tear, enhance the vascularity at the repair site by abrading the synovium or by doing the needle trephination. If you are going ahead with the all inside meniscus repair, usually you use a horizontal or a vertical suture with a 2-0 fiber wire. There are many implants which are readily available in the market. They are quite easy and very fast to use. You can just master one of these implants of your choice. If you are doing an inside out technique, there are zone specific cannulas which are very helpful if you are doing a inside out technique. In the inside out technique, if you are using a zone specific cannula, then there's a curved cannula which is introduced from the contralateral portal. You use a 2-0 non-absorbable suture like a fiber wire on a flexible long needle which is passed through the cannula, and the needles are retrieved outside, and finally you tie a knot outside. If you are doing an outside in technique, then the sutures are passed from outside in through a straight or a curved needle. The knot is created when the sutures pass across the tear, and the sutures are then pulled tight and then tied outside.